Good afternoon. I'm going to share my screen here and want to thank you for inviting me to engage in this conversation. I'm going to follow in Inch's footsteps and here sort of frame my thinking about how we come to address this issue. And I really appreciate this quote from Bell Hooks, who charges us to really think about justice outside of these simplistic binaries. I think the work of public health very infrequently has singular solutions to societal and structural problems. And so I hope that this conversation can help us explore what sort of the both and thinking and practice ends up looking like, because I think that that is what is going to be necessary in order for us to truly address the challenge of mass incarceration and think through what the solutions to this challenge are. I too want to start by sharing this photo of really my first public health job, because I come to my thinking about not only mass incarceration, mass criminalization, but reform and abolition through my both personal and professional experience. And so I won't name the location or the place where this is, but this was a jail where I worked in a large urban city as a health department employee, department of one, where I was situated for many years. And I think it has helped really frame my thinking, not only about the field of public health, but about how we have failed to address the harms caused by this system. And this has really shaped my professional experience and my thinking about this issue, but so has the fact that I'm a Black woman, a wife, I am a mother to Black boys. And my experience in life in my community as a family member and as a community member has really also sort of helped to shape my thinking about where we go. And so I hope to really indulge in what I would consider more of a disciplinary critique about how we have come to this place and what public health has done and or failed to do to really think about this as a challenge that we can work to address here. And so, as I mentioned, I started this work doing some really specific public health work in a correctional institution, with my thinking really being framed around addressing harms that were very specific and narrow, thinking that I would make a huge impact on my community. And while the work that I was doing was very meaningful and from a public health perspective addressed a very significant issue at the time, which in general is still a significant issue, I came to realize that I started to experience some frustration over the course of my time and the 17 years of which I was working in a jail, was that I felt like I was doing nothing to prevent the influx of people into the system, right? I was addressing a need of which I had recognized that our public health systems had failed to address for folks in community, and was serving as sort of a stopgap to the services that people really needed. And so it sort of helped me sort of shift my thinking around, if I was truly committed to improving the lives of the people in the communities most harmed and most impacted by the system, was this the right and appropriate strategy for me to take? And so I went through this program. It was quite a meaningful experience. It helped me get a couple of degrees, right? And in the meantime, it helped connect folks to programs and services and folks to care in really meaningful ways, but it was doing nothing to disrupt the system. And so it really has brought me to a place where I have to question really, what are we doing about sort of understanding mass criminalization, mass incarceration, and public health? And what are the tools that we have available to us to understand this question and then to do something about it? I think there are some very specific questions that public health needs to ask both ourselves and others, our communities of which we work in. And those just include some of the things listed here on this screen. But importantly, I think for the purposes of this conversation, the focus on really what can and should we do about it with the skills and expertise that we have and that we can bring to bear on this. And so really the question comes to me is sort of, we've had this conversation about the either or, the reformist reforms as frequently called, or abolition. I appreciate Incha's commentary about abolition is really about the presence of creating systems of health and well-being to sort of replace the systems, the punitive systems that we've currently have in place. And so as sort of I dig into this idea about mass criminalization and mass incarceration, I think we have to think about the work of public health being the work of social justice, the work of health equity, and the work of human rights, and ask it, and I use this term very explicitly, is do we have a responsibility to do the work of reform and abolition? Can this work be done collectively, or do they have to be thought of completely separately? And I ask this as a proposition because I'm very challenged by the either or perspective, because recognizing that we have more than 2 million people currently behind bars, if we take an either or approach, we risk continuing to perpetuate the harms of the system for those folks who are still caught up in the system. What this has also made me realize as I was doing this work is to think, and I'm using the term we as sort of the collective we, the public health community, is sort of what are we doing to address the harms of mass incarceration? And to be honest, I said this was going to be a disciplinary critique, I would say not much. Right. So as we think about if we are going to really be effective at bringing forth our skills and expertise to work in partnership and collaboration with communities who have been harmed, then we have to be skilled and trained to be able to do that. And in doing some research for some work that we're doing here at UNC, we've done a reflection on what are schools and programs of public health doing to sort of help students understand the challenges that are experienced. And I would say very few schools are doing anything about integrating this content into the existing curriculum. There are very few training opportunities for folks to understand the criminal legal system, even things as simple as understanding terms and definitions, because when we think about addressing these harms and developing evidence-based solutions, what we think about doing for one institution, a jail in particular, may not be the same actions we need to take for prisons. There are two different environments. They operate very differently. They have different levels of engagement, and they are managed by different entities. And so I think things as simple as making sure that we are all clear about the terms and definitions that we use. I think the demographic data and associated health data of people who are in the system, not only those folks, but their families and the communities that are impacted by their system, is minimal at best. We have not done a good job of framing incarceration as a social structural determinant of health and thinking through that our responses, speaking of abolitionist responses, are social structural responses outside of sort of the narrow health behavior perspective. And really that we can situate our thinking of understanding the problem in social theory, right? And exploring those solutions. So there's opportunities for us to dig into theoretical foundations that help us think through what solutions look like. I think our focus should also be on really digging in deep to really what it means to address social determinants, because that can serve as the primary prevention solution for keeping people out of the system in the first place, no matter what the system looks like. I think we have to address the here and now of the problem while also thinking of sort of what the future is that we want to create and build in all levels, from sort of those reformist reforms that we can think through as sustainable solutions that get us to abolition. I think what I have done in my work, so taking it from sort of being in community as a pracademic to coming into an academic setting, recognizing that we have this deficit in training, is that I've tried to create courses at Gillings that help to introduce not only the thinking around mass criminalization, but mass incarceration, and thinking through all of those challenges along the way to how we get to solution, how we get to the goal of abolition. It cannot happen in a vacuum. We don't have the luxury of waiting for the social political environments to change. We have to work at all levels, at all stages of this problem to address the harm. And so I would say really our call from a public health perspective for me is really to dig into the social determinants of health as the primary prevention tool from keeping people entering into the challenging system. The other thing that I would say is when we fail to train students and the future public health workforce on understanding the system, we therefore have failed the practitioners. And so as a practitioner, I was a department of one. I spent 17 years working in this department. feeling like I was working at the fringe of public health. I would say to this day, there are more people doing this work and engaging in this work, but it has not been integrated into the work like it needs to be if we are going to actively play a really sustainable part in reimagining a new system of health and wellness and care and accountability. And so I think there's some really clear strategies that that certain organizations like Human Impact Partners have identified for the work of public health practitioners. But we can't get to the work of the practitioner if we fail to inform and educate the students on the system and how we get to doing that work and coming up with these evidence-based strategies. I would also say that it's important for us to also think through that we have to move beyond these declarations, similar as we have done to address racism, but all systems that are rooted in systemic racism. So we have to have really actionable, financially responsible actions to communities that are most impacted. And if we fail to address this issue of mass incarceration, inevitably, we will not be able to address the harms or health inequities as we have deemed them as critically important for the work of public health. So I will stop there, and I'm excited to continue to engage in this conversation.